Hello and welcome to our presentation. We're going to be doing an awareness presentation about stroke for you. It's nice to meet you. My name is Tara Lakin, and on the call is my two colleagues that work in Kent, Christina Bayliss and Claire Brack. Thank you. So we're going to be covering today what is a stroke, the impact of the stroke on the stroke survivor and their family members, various types of stroke support that will be available to you, awareness around the FAST test, stroke prevention, and how to take action on stroke. So what is a stroke? I'm going to be sharing with you now a short video that covers what is a stroke and its effects.
What is a stroke? What happened to me changed everything. It changed the way I think, the way I move, and what I'm able to do. I'd had a stroke, an ischemic stroke. It's the most common type where a blockage cuts off the blood flow and oxygen to your brain. Part of my brain had just shut down as a result. There is another type, hemorrhagic stroke, caused by bleeding in the brain. Any stroke can be life-changing, and it can happen to anyone of any age. Stroke affects everyone in different ways. For me, it was my sight, my speech, and weakness on the right side of my body. I lost part of my vision. Talking became hard because I just couldn't find the words to describe things, and I struggled to walk more than a few steps. I was so exhausted all the time with just no energy to do normal, everyday stuff. Remembering things and concentrating became almost impossible. And I couldn't read much or even write my own name. It was really scary and confusing. And even though I had my family, I felt lost and alone. I had all these questions like, will it happen again? Will I get better? And will I be able to work or earn money? Everything was up in the air. My family were sick with worry and their lives changed in an instant. It was really hard for them. Once I knew more about what had happened, I began to see a way through it. With help, over time, your brain rewires itself by making new connections. Knowing that I could get back most of my old self was what kept me going. Recovery is hard, but each month, each year, things improve. Now I can have conversations with my family, and I'm going for walks again. I'm not alone. The Stroke Association helps me and my family to adapt and understand things. Life might not be the same. I might not be exactly the same as before, but you and your family can rebuild your lives. It's like getting used to the new you.
Thank you. I hope you enjoyed that short video. So as covered in the short video, there are two different types of strokes. 85% of all strokes are caused by ischemic stroke, which is where a blockage happens in the brain. And then more rare is a bleed, a hemorrhagic stroke, which is for about 15% of all strokes. Next, we're going to cover the impact of stroke.
Every day in the UK, another 240 people wake up with the catastrophic impact of a stroke. A stroke robs survivors and their families of the life they once knew. Anyone from mums, dads, grandparents, young people, and even children. Brain damage caused by a stroke can leave survivors unable to move, see, speak, or even swallow. The effects can be more than physical too, with many survivors also left with personality changes and depression. All strokes are different. For some people, the effects may be relatively minor and may not last long, while for others, they may be left with more serious long-term problems. On screen are some of the wide-ranging effects of stroke. These might be physical or psychological. Emotional impact can include feelings of shock, denial, anger, and grief, making it very difficult to cope. A stroke can also affect the way your brain understands, organises, and stores information, known as cognition, and problems with memory and thinking are very common. Communication problems are also common after a stroke, with around 1/3 of stroke survivors having problems with speaking, reading, or writing, or telling the time, using technology, or perhaps dealing with money. Stroke might also affect swallowing, vision, walking, writing, and fatigue is also very common. Fortunately, most people make significant improvements in the months following their stroke, but they usually need ongoing help and support after they leave hospital. In 2018, the Stroke Association conducted the largest ever survey of stroke survivors and their carers to find out more about their lives. Over 11,000 people affected by stroke in the UK took the time to share their stories with us, and we now know more about the everyday experiences of those living with the effects of stroke, which can sometimes last a lifetime. The survey showed that 98% of stroke survivors told us their lives had been affected by stroke, and many of these people felt the impact was significant. More than 1/3 of working age stroke survivors gave up work after their stroke. For 69% of people, stroke impacted their independence, while over half of stroke survivors told us their relationship had been impacted by their stroke, but only 1/3 accessed relationship support. And 64% of stroke survivors told us their hobbies had been impacted since their stroke. There are over 100,000 new strokes every year and over 1.4 million stroke survivors in the UK today. 2/3 of these people leave hospital with a disability. The cost of stroke to our society is around 26 billion a year and is the 4th biggest killer in England and the 3rd in Scotland and Northern Ireland. Stroke recovery is a long, hard slog of repetitive therapy, and progress can be painfully slow. Stroke survivors have to relearn things that most of us take for granted, like how to walk, speak, or even eat. Recovery can take years. It impacts every aspect of their lives, of the stroke survivor and their family.
Stroke recovery is possible through stroke support. So who are we? We're the Stroke Association, and we're the only charity in the UK offering lifelong support for all stroke survivors and their families. Why do we exist? Because tens of thousands of people survive a stroke each year. Their lives are turned upside down and they often left with in critical need of support. We believe no one should survive a stroke only to lose the rest of their life to a stroke. Extensive research has shown that the general public's understanding of stroke is shockingly low. We need to show people what surviving and living with stroke is really like. So we're here to support every stroke survivor to achieve their best possible recovery so that they can move on from just surviving a stroke to finding their way back to life. So how do we do this? We provide tailored support to tens of thousands of stroke survivors each year, including one-to-one and group support. By funding vital scientific research into all aspects of stroke, and by campaigning for what matters most to stroke survivors and their loved ones. So we offer 2 vital stroke frontline services, our Stroke Support Helpline and our Stroke Support Coordinators. The Stroke Support Helpline connects survivors and their families to other stroke support services, such as stroke support coordinators, peer-to-peer and group support, as well as local community services that might be helpful throughout the recovery journey. Whether someone needs information or guidance, or a chat when times are tough, the helpline is always just a phone call away. Our stroke support coordinators. So our support coordinators provide tailored one-to-one support for survivors and their loved ones, trying to make sense of the new and terrifying post-stroke world, one in which they might otherwise feel isolated and alone. Provide vital one-to-one support that stroke survivors and their families need for as long as they need it. Work to understand each stroke survivor's individual needs so they can tailor support what matters most to them. Help survivors to make sense of the advice of medical staff and understand their diagnosis and medication. support and encourage survivors to commit to their rehab therapy and provide the crucial emotional support that is so often needed after the trauma of a stroke.
Thank you, Claire, and thank you for all the support that you do as a coordinator for stroke survivors. At the Stroke Association, we also fund critical research. So since the early 1990s, we've invested 60 million into stroke research across the whole pathway, with almost half of our portfolio of research into rehabilitation and recovery. And the research has funded to help establish a vibrant community of stroke researchers in the UK and to advance our understanding of stroke, as well as improve treatment and care for those that are affected by stroke. We also campaign to prevent strokes from happening and from improving treatment and care. And we do this in 3 ways. By making sure that governments and senior healthcare makers know about stroke and see it as the priority that it is and worthy of the attention and investment. We also work with local and national NHS systems to change policy in the ways in which that most people benefit affected by stroke. And we enable the public and people affected by stroke and our supporters to campaign for improvements in stroke care locally. When people bring their own views, their own experiences, skills and expertise and connections to our campaigns, we can have the most amount of impact.
Now we're going to talk about the FAST test. So we know that acting fast is vital for recovery from a stroke. If you suspect a stroke, even if the symptoms pass, do the FAST test and always call 999. But what does FAST mean? F is for face. Has their face fallen on one side? Can they smile? A, arms. Can they raise both arms and keep them there? S, speech. Is their speech slurred? If you see any single one of these symptoms, it's time to call 999. The FAST test helps spot the 3 most common symptoms of stroke, but there are other signs that you should always take seriously. These include sudden weakness or numbness on one side of the body, including hands, legs or feet, difficulty finding words or speaking in clear sentences, sudden blurred vision or loss of sight, which can be in one or both eyes, sudden memory loss or confusion, a dizziness or a sudden fall, or a sudden severe headache. If you spot any of these signs of a stroke, don't wait. Call 999 straight away, even if the symptoms pass. Ambulance paramedics are trained in stroke and will take the person to the best hospital for specialist treatment. And these symptoms, along with those in the FAST test, also apply to something called TIAs.
Stroke prevention. So we're now going to be taking a look at how we can work to prevent strokes in the future. So why is prevention so important? A stroke can happen to anyone, but there are some things that can increase your risk of a stroke. And it's important to know what the risk factors are and do what you can to reduce your risk. While most people who have a stroke are older, young people can also have strokes, including children. 1 in 4 strokes in the UK happen to people of working age. So what can cause a stroke? Everyone has a different risk of having a stroke, and it depends on the unique factors that belong to them. Risk factors can be anything about you and your lifestyle, like your age, a health problem that you currently have, or whether you drink or smoke. Strokes can happen to anyone of any age, but as you get older, your arteries become naturally harder, making them more likely to be blocked. You can take active steps to reduce your risk of stroke at any age, which we call modifiable risk factors, and we'll look at these in a moment. There are some health problems which can raise your risk of a stroke, such as atrial fibrillation or AF. And this is where your heartbeat is irregular and may be abnormally fast. This is a risk factor because the heart might not empty itself of blood within each beat, and a clot can form in the blood that's left behind. A clot can travel to the brain and cause a stroke, and most people don't get any symptoms, so it's important that you get your blood pulse checked. If you have an untreated atrial fibrillation or AF, your risk of stroke is up to 5 times higher, and a stroke can be much more severe if you have AF. High blood pressure. This puts a strain on all of the blood vessels throughout your body, including the ones leading to your brain. This strain can damage your blood vessels, causing them to become harder and narrower. And this makes a blockage more likely to occur, which can cause a stroke or TIA. It's very important to check your blood pressure regularly and understand what the numbers mean. Diabetes. This can mean you have too much sugar in your blood, and this can make you more likely to have a stroke. This is because too much sugar in your blood damages the blood vessels. It can make the blood vessels become stiff and can also cause a build-up of fatty deposits. These changes can lead to a blood clot, which can travel to the brain and cause a stroke. Having too much cholesterol in your blood can also cause fatty deposits to build up in your arteries, and this can mean that the arteries narrow and stiff and make it harder for blood to flow through. It also increases the chance of a blood clot developing. If a close relative, such as a parent, grandparent, brother or sister, has had a stroke, your risk is likely to be higher. Speak to your GP if you have any close relatives with stroke or heart attack, as some kinds of high cholesterol can in fact run in families. Strokes happen more common in people that are Black, African or Caribbean, or from South Asian families. If you're Black or South Asian, you may need to get checked at an earlier age for diabetes, especially if you have any risk factors like being overweight. Please contact your GP if you need a health check or have any questions. So what can you do to reduce your risk of having a stroke? You can help reduce your risk by making healthy lifestyle choices. Whether it's your diet, activity levels, smoking or drinking, it's never too late to give up, or it's never too late to make a change. Regularly drinking too much alcohol raises your risk of stroke. In the UK, the government advises that it's best to keep to low levels of drinking alcohol, no more than 14 units per week, and spread the units out across the week rather than drinking all in one evening. The limit is the same for men and women. So please note that change has happened recently, and the limit is set the same at 14 units a week. Smoking doubles your risk of dying from a stroke, but the minute you quit, your risk of stroke starts to drop off straight away. Stopping smoking can be one of the best things you ever do for your health, and there's lots of help available, but giving up isn't easy, but it's worth the effort for improving your health. Being overweight or obese can raise your risk of a stroke. Extra weight affects your body in many ways, such as raising the risk of high blood pressure and of raising the risk of type 2 diabetes, which are both linked to stroke. Eating a healthy, balanced diet can help to lower your risk, like things of blood pressure and diabetes. Even making small changes to your eating habits can make a difference to your overall health, particularly if you've been told that you are at risk of having a stroke or a TIA. Being physically active can help reduce your risk of a stroke. Moving around can also help your emotional well-being by releasing chemicals into your brain that make you feel better. If you already have a health condition linked to stroke, sticking to the treatment can help you to reduce your risk. If you've had a stroke or TIA in the past, one of the best ways to reduce your risk of another stroke is to follow the treatment for your health condition as advised by your doctor. You can contact your GP or book an appointment if you do have any questions about any of this. Thank you.
So take action on stroke. As a charity, we rely on the generosity of our amazing supporters. There are so many ways that you can support us to support stroke survivors and their families. We are always looking for volunteers. You can find out details on our website. And we're also always looking for fundraising opportunities too. Again, details can be found on our website. Also, you can follow us on social media and share our posts. The communication access symbol has been developed to enable people with communication difficulties to identify businesses whose staff members are trained in communication support. Anyone, including businesses, organisations, or even family and friends, can voluntarily sign up for free accredited training on the Communication Access UK website.
Thank you very much for your time.